taking into consideration the positioning, for example, in here we are seeing a scan for limbs and over a pretty small patient. And in here we use normally for limbs dorsal recumbency, the use of cushions to support and align the anatomy. And also the limbs have to be moderately extended to the gantry, and also to be a little bit distanced between the two. And theoretically, the bone of interest should be placed at 90-degree angle compared to the CT gantry. Okay, this is a funny image. So we are vets and we scan a lot of different animals. And we have to consider that we can run into some funny situation. So normally we work only with dog and cats, but some patient, like for example the duck, don't need any anesthesia. It's just best to lay down with some towel around her, and no problem with the CT scan. Also, we have some very small patient, and this is pretty challenging to get a proper resolution. And also some long, very long patient, like the white snake on the center. And yeah, with just one scan is not possible to take all these animals in one scan. And then also, for example, on the top left, the eagle is with some very peculiar anatomy. So the bones, for example, are full of air. So in the slicing, the segmentation is not so easy at all. Here we have a common mistake for a motion artifacts on the radius. So you see the radius as a small step, and this is just a breathing artifact. And if a vet gives you a CT like that to reconstruct and maybe do a limb, angular limb correction, would be not so ideal to make guides system on these artifacts. So the proper scan is on the right, and this is without the motion artifact. This looks like just a fracture. We have also metal artifacts, and they are very hard to deal with, and we have some algorithm, and they depends on the CT scanner mainly. And also other artifacts. There are a lot of artifacts to deal with, like the beam hardening artifacts or the volume averaging, where can go with a very poor quality anatomy reconstructed. So in general, I think that the better the acquisition, the fastest the segmentation, and the better the 3D model will be. So we have to keep in mind what we have said, because there is no just do the model, here's the CT. We have to think about a little bit, just a little bit to the CT, because the CT of nowadays is very simple acquisition compared to some years ago, especially in veterinary. Nowadays, we have good scanner too. And so with just a few little points, we can get a good model for our engineers. And of course, also for radiologists, because I'm a radiologist, and I think that I can be put in the middle between the surgeon and the engineer to try to make the collaboration better. So I think that the segmentation of the anatomical structures is our job. And so we should interface more between the engineer and the surgeon, trying to speak the same language or both, I think.